Your milk supply, it is probably the number, I don't know, 1, 2, 3, 4, 5 list of concerns that most mothers have when they are breastfeeding their newborn. They don't know. They're very distracted. Do I have enough milk for my baby? Is my baby able to get enough milk? This will be like a series of maybe part 3 or 4. Today, I'm just going to address what's normal and what you should expect as far as volume, at least in the first few days of breastfeeding, because that's probably a time period when moms have the least amount of faith in how much their baby is getting, largely because their breasts aren't filling with milk and they're new to newborns, and it's hard to tell if your baby is getting enough. So I want to talk about what you should normally expect. And the first milk that's available, we're going to talk about right now, which is colostrum. So the colostrum that your baby gets, a lot of people think I don't have milk until the third or fourth day and their breasts are really full with milk. But you have milk literally from the fourth or fifth month on. It's called colostrum. It's milk, it's just different. And this is comes in very small quantities, but just because it's small quantities does not mean that it is not enough milk for your baby. It is just the right amount. So the first thing I want you to think about is volume. If you can picture the size of a very small marble in your mind's eye, or if you can picture what a teaspoon of fluid looks like, that is about how much milk your baby can get from an average breastfeeding the very first day of life. And typically, on your baby's very first day of life, they may feed 2, 3, or 4 times, but each feeding should be a really good feeding. And while I don't want to time you so much, and I don't want to tell you exactly how many feedings or exactly how much they should get, because I feel like that's how we go down that rabbit hole of a specific expectations, and breastfeeding is certainly far from an exact science. But if I were to say the average day, your baby should get between 2 to 4 good breastfeedings, take about a teaspoon at each feeding. And if you were thinking about a teaspoon, if you can get that in your mind's eye, and I want you to think about the fact that it would not be uncommon for it to take your baby a good 20 to 30 minutes, either from one breast or both breasts, to get that amount of fluid. Again, just because it's a small volume visually, you should never think that it's not enough. Your baby's stomach is very small, the size of a small marble, when they're born, and they need time for it to stretch out a little bit. And so by the second day, a well-fed baby should easily be feeding anywhere between 7 to 9 times a day, usually both breasts, but not always. And now between day 2 and day 3, your baby is going to work up to day 3 about a tablespoon per feeding. And again, I want you to take a picture or just get a picture of a tablespoon of milk in your mind's eye. It's not a lot, but again, quite sufficient for your baby to get that volume from each feeding, and again, 7 to 9 feedings a day. If you are doing that, that is absolutely terrific, and you are right on target. Now, part of the problem for mothers is that their breasts may not necessarily be feeling the fullness, and so you're always questioning. So there are other things for you to take a look at as far as thinking about if your baby has had enough, and we are going to go into that tomorrow and then go on from the third day to about the seventh day. So we're going to take this in baby steps. I'm going to end with just some food for thought. One of the things I like for moms to do is to plan for breastfeeding during their pregnancy, and for you to rule out any known risk factor for possibly having a low supply, not making enough milk for your baby. And while these are not all the reasons, these are some of the common reasons. So one is any kind of breast surgery that you may have had may put you at risk for not making enough milk, and it may totally not interfere in the process at all, but it is something you do want to talk to your healthcare provider about. Some medications you take may cause you to not have enough milk for your baby. some medical conditions, some hormonal imbalances, and also if you have between both of your breasts, some moms have a severe difference in the size of their breasts, some have insufficient glandular tissue of their breasts, and all of these things can be taken a look at during your pregnancy, which may highlight a risk factor for making enough milk, and that's something you would surely want to know about ahead of time. All right, well, that is it for today, and we will add to this tomorrow. I hope everybody is having a wonderful day, and goodbye from Lori Jill Eisenstadt, IBCLC, from allaboutbreastfeeding.com. Have a wonderful day.